Tantor Audio, a division of Recorded Books, presents The Gift of Caring, Saving Our Parents from the Perils of Modern Healthcare by Marcy Houle, M.S., and Elizabeth Eckstrom, M.D., M.Ph., narrated by Randye, Kaye. This audiobook is packaged with bonus material, which has been included on the first audio and MP3 CD. If you downloaded this audiobook in a digital format, please visit Tantor.com and type The Gift of Caring into the search box. Follow the link to the book's page, then click on PDF Extra 1. When prompted, enter the access code KNOWLEDGE to access the bonus material. To love or to have loved, that is enough. Ask nothing further. Victor Hugo, Les Miserables. Forward. Jenny Chin Hansen, former CEO of American Geriatric Society, past president of AARP. This book is a lyrical, intimate love story of a daughter, Marcy, and how she rose and struggled to provide dignified care for each of her parents over a 14-year period. It's a journaling of care as she lived through the journey of their changes, with her father from Alzheimer's disease and her mother from a slow but progressive frailty. The reader travels through the struggles, triumphs, advocacy, tears, and conflicts of a devoted daughter, juggling the everyday needs of herself, her understanding children, and her supportive spouse, coupled with managing a number of personal home workers, from the divine to the harrowing. What makes this caregiving narrative different and special are the companion chapters written by an expert geriatrician who provides both reflection on and knowledge of what transpires in every few chapters written by Marcy. This is a unique form of riveting narrative that gives us, as members of the general public, a usable medical understanding and practical tips that will help us anticipate, appreciate, and prepare for a more effective journey as we approach the universal care-providing experience we will all encounter, whether with our loved ones or when we ourselves will someday be given care. This book is a gift. It is written to assure the best possible dignity while also advancing the best in care as we travel the journey of life and living until our final chapter is completed. 1. The Airplane Diaries. For age is opportunity no less than youth itself, though in another dress. For as the evening twilight fades away, the sky is filled with stars, invisible by day. Henry Wadsworth Longfellow. 1. Colliding Worlds. I never used to worry about getting old. Most younger people don't, but I had extra proof that aging was not a problem. You see, I was a later-in-life child. My parents had me when they were 40. My mother used to laugh that she was the oldest mother at the first-grade PTA meetings. She was on the leading edge to 50, while the majority of the parents were barely in their 30s, if that. I always thought that she had the last laugh, though, for of all my friends' parents, most considerably younger than mine, my mother and father were the most active, energetic, and fun people I knew. The word retire never entered their vocabulary. If he could have, my father would have continued working until the day he died. My mother did continue until she passed away as a helpmeet to my adventuresome father and a mother of 3 very active girls. My father was a doctor. Aside from my mother, the love of his life and his family, his deepest affection was for the practice of medicine. It began when he was 8 years old and visited an uncle, a surgeon in San Francisco. At that moment, he knew that was what he wanted to be. During medical school, he refined his passion to orthopedics. There was nothing he enjoyed more, evidenced by his entreating his daughters to follow in his footsteps and all become doctors. None of us did, which he felt was a shame. The satisfaction he received from treating ailing people was deep and abiding, and, in his mind, nothing could top it. But there was more to it than just doing surgeries. His special concern was for those people who were too often cast off by society. For decades, he treated disabled children, predominantly those with cerebral palsy, and in the 1950s, established the Child Development and Rehabilitation Center at Oregon Health and Sciences University, where he was a part-time professor. Teaming with Shriners Hospital, the program treated disabled children from birth to 21 years of age. It still exists today. After spending 20 years with these patients, my father often developed a close association with them and their families. Another segment of society was too often neglected, he thought. Through the years, I saw him pay special attention to older adults. In his era, when most people turned 80 and broke their hips, a surgeon wouldn't touch them. Too risky, but my father said he firmly believed that if these old people could safely be fixed with an artificial hip and be relieved of severe pain and immobility for the remainder of their lives, it was worth the chance. He was successful, and his patients loved him. Many of those with repaired hips lived to be in their 90s and with a renewed quality of life. Practicing good health habits was important to my father, and so it trickled down to all of us. Fitness was always a big part of his life. He loved to walk and believed that his patients and family should feel this way too. He encouraged everyone to stay active. It didn't matter how old they were. In this, he was a little bit of a revolutionary, being ahead of his time. Living in Portland, Oregon, where the jogging fad first began with Adidas and Nike, my father took notice. Initially, it was not just for increased fitness. It was because of the shoes. After observing hundreds of patients in his practice, he believed that a large proportion of foot problems, bunions, hammer toes, rolled ankles, could be attributed to wearing the wrong kind of footwear. This was especially true with his older patients, many of whom were experiencing problems with walking. He talked to distributors and shoe suppliers and made a display in his waiting room of a sampling of 3 or 4 models of Adidas and Nike shoes. Before long, running shoes became one of my father's signature prescriptions for people with back, knee, and foot pain. I always wanted to laugh when I saw the little old ladies going into Nordstrom wearing running shoes. I knew they had to be my father's patients. Growing up, I saw other people growing old, never my parents. In our 20s, some of my friends began to notice that their mothers and fathers were starting to slow down. A few began suffering from heart conditions in their early 60s or complained of mounting arthritis. Other parents started eliminating things they had once enjoyed, such as downhill skiing or long car trips or even going out at night. Not mine. If anything, their 60s seemed to give them even more energy. At 65, my parents were taking some of the most adventuresome trips of their lives. At 68, my father took up jogging, and twice a week we would run together for 3½ miles on a woodland trail near my parents' home. At the same time, my father began ramping up his care of old people. He had always made it a practice to visit nursing homes, but as he got older, he went even more often to volunteer his services for something he said was too often terribly neglected: caring for toenails. All the time I was growing up, I had heard about toenails. I found it a little disgusting, especially at dinner, but we all got the lecture. When people got old and confined, he explained, their toenails were often left uncut, and this caused a lot of problems. For if not properly cared for and trimmed, toenails grew thick and long and curled. Older people especially needed to have routine care, for long toenails also created walking difficulties and made for very painful feet. Too many nursing homes never bothered caring for people's feet. This greatly disturbed my dad for whatever reason, and so for many years, on days when he wasn't conducting surgeries or seeing patients, he carved out time to visit local nursing homes to trim old people's toenails. He never charged for his services. Of course, like all families, health problems came up now and again in ours. In her 70s, my mother had a problem with dizziness, but with proper treatment and drugs when episodes hit, she weathered through. My father had a rough bout with prostate cancer at age 70 and required major surgery. But in my mind, as the years continued ticking by, these events were just part of life. Everyone had circumstances thrown at them that required dealing with. As a sort of proof of this paradigm, I observed my parents, while in their early 70s, still canoeing rivers, camping, and taking their little boat on excursions up the Columbia River. At age 75, my father was talking about taking a third canoe trip on the Yukon River. With parents like that, who would think too much about aging? In my experience, I saw that if you worked hard, did service for others, had good friends, kept active, ate well, stayed trim, and kept intellectually curious, you could never grow old. Aging just went along for the ride, like a parallel universe that didn't really impact your real life very much. When it did, like when you needed new reading glasses or your hair got a little whiter, you didn't dwell on it. There was another reason for my lack of worry. Deep down, I felt secure in having a father who was a doctor. After watching him for 40 years, I knew that doctors took care of elderly people conscientiously. I knew with naive certainty, if there ever came a time when we might need a doctor for him or my mother, medical support would be there. There would be plenty of doctors and nurses and welcoming hospitals and good prescriptions, like Nike running shoes, should my parents need them. And if my dad someday couldn't cut his own toenails, well, there would always be someone else who cared enough to do it for him. As the saying goes, what goes around always comes around, right? Wrong. Terribly wrong. And when the parallel universes of aging and life at last collided for my parents, I was probably the least prepared of all to grasp it, for it had never entered my thinking that this could happen to them. Or when they desperately needed help, it would not be there. 2. First decline. In my experience, the tsunami of growing older didn't happen all at once. Rather, it came in small floods, with drying out periods in between. When we began seeing little hints that changes lay ahead, we discarded them, usually as quickly as possible. This is a characteristic reaction, I believe. We want to refuse that there may be a serious problem for someone we love. So when the intermittent high waters began coming, we refer to them, at least at first, as anomalies. The first time my dad exhibited an uncharacteristic behavior, we decided that he must have had his mind on something else. I was visiting my parents' house when it happened. My father drove up, walked into the house, and seemed unsettled. I'm sure glad for my new friend he helped me get home. It was such an odd statement that it got both my mother's and my attention. "What new friend?" asked my mother. "The one I met on the on-ramp. I was coming home from Costco. The groceries are in the car. I got to the freeway, and thank goodness he was there." "Did you have a flat tire or something?" I asked, rather perplexed myself. But if he had a flat tire, I would have expected him to call AAA. "No, nothing like that. I got to the freeway ramp, and for whatever reason, I couldn't remember how to get home." A chill went up my spine. My father could be sometimes, a bit absent-minded if he had his mind trained on something else, but he had a good sense of direction. I pulled over, and it scared me for a second, but then my new friend came to the car window. He told me how to get home. My mother looked puzzled, but my father seemed himself again. "Could you help me unload the car?" he asked me. Gladly. I wanted to move and forget the entire thing. It wasn't worth worrying about. I told myself there must be an explanation.
Sample complete. Ready to continue?